When I went to nursing school, I always knew that I wanted to go back to school eventually. Initially it was to become a nurse anesthetist, but once I started working in the ER and the ICU, I really enjoyed hands-on patient care a lot. So I made the decision to go back for my acute care nurse practitioner. Definitely, I think a big part of it, especially now looking back, was probably, as most people would assume, COVID pandemic. I was working in the ICU at the time. It was very difficult in the beginning when family members were not allowed in, but I did kind of make sure every day, no matter what time it was, even if I was at home with my kids making dinner, that I updated each family every day on what happened with their loved ones. Something that was rewarding that came out of such a tragedy was, for me, just how everybody in this hospital, nurses, physicians, x-ray techs, other radiology departments, medical assistants, how everyone was just a cohesive unit and how we all came together to try to do what was best for our community. We have an aging population, as we all know, in the country, and I think that advanced practice providers, both inpatient and outpatient, are going to become more prominent and more useful. I'm hopeful that maybe Georgia eventually will move to more of a unrestricted practice and more of a free practice for nurse practitioners in the future. Work for a little while after you get your nursing license, get some experience, because that'll kind of help direct you as to what you really want to do, what you might be interested in, and that baseline experience also helps you in the long run when you do decide to go back to school for further education as well. Now I feel like with infectious disease, I'm kind of tied to my community. I do inpatient and outpatient, which is different than I did before. Before I was just inpatient only. So it's kind of nice now if I see a patient in the hospital to be able to follow them in my clinic and see them get better and see their progress. That's very rewarding for me, and I feel like I'm more a part of the community because I'm getting to follow those patients as an outpatient.